Hello and welcome to the Oath and Staff podcast. I am A. David Singh, bringing you stories from people of medicine who serve humans and animals in unique and wonderful ways. In today's show, I am talking to Dr. Justy Chiramal. She trained in internal medicine at CMC Vellore, South India, followed by tropical medicine and epidemiology abroad. Justy describes herself as a mom and physician who got into artificial intelligence. She's being modest when she says that because now she's the director of product development and innovation at a healthcare AI company in the USA. Welcome, Justy. Welcome to Oath and Staff.
Thank you so much, David. It's a pleasure being here, and I'm really honored to be part of this engagement, and excited to share some of the stories that I've been through and what I've done. So, looking forward to this.
The pleasure is all mine, Justy. Let's kick things off at the beginning. After your initial training in South India, which countries have you trained and worked in? Tell us about your adventures abroad.
Great. After I did my MBBS in internal medicine MD from CMC, I was in Bangalore at Baptist Hospital for a while, and I thought lifetime of studies is done. I did have plans to do fellowship earlier, but had paused it um, because I didn't want it to be very narrow at that moment, and I wanted to keep myself looking at the whole human body. So I joined Bangalore Baptist Hospital, and I worked for about 4 years. We were serving the urban poor, in Bangalore who was coming to the hospital. So for me, what stood out was the late diagnosis in a lot of these preventable diseases, especially infectious diseases. I remember when I was doing my MD, there was this resident from Stanford who had spent about 4 or 5 weeks in Vellore, and she told me about this tropical medicine course in Peru. So I thought I should apply to it, though I don't think I was expecting a vast variety there. But she was talking more about the network and the opportunities and the broader thinking that I could gain from there. So I looked up this course by Cayetano Heredia University in Lima, Peru, and I applied for it. So the process is like 1.5 years ahead, you have to apply. And then they let you know, and then all this visa process and all that stuff, because it's a 2.5 months course, including 2 weeks in the Peruvian Amazon, in the jungle, and altitude medicine in Cusco, that Machu Picchu area and all that. So it was very exciting as an travel enthusiast. So I decided to apply for it. While looking at that, I also came across this Asian tropical medicine in Thailand, in Mahidol University. So I applied for it and I got a scholarship. Yeah, it was a 2-week course in Mahidol University, including primary clinic visit in near the Thai-Myanmar border. So that was my first stint actually in 2014. I think it was an eye opener to see the infrastructure, right? Like even for public health, like for dengue, how they were putting up posters everywhere in the local language, including graphics, so that any literate person can understand what are the precautions to be taken for not having mosquito bites. So that kind of got me excited. By then, I got to know that I'm selected for the Peru course. And I found that 2, 3 of my friends from Thailand are coming to the Peruvian course as well. So we already strategized being roommates and things like that. Then I went to Peru, and Peru was a phenomenal course, intense course where we're leaving at 6:30 in the morning. I had to learn Spanish and interact with patients. Some of the cases that I hadn't seen, like yellow fever, I saw yellow fever in the Peruvian Amazon and a lot of other infectious diseases. The profile is a little different. We've seen HTLV patients in Vellore, but there is a lot more patients like that in Peru. So, and a lot of fungal infections. That was very interesting for me, and the network, right? The teachers, the faculty who came have been in the front lines of Ebola disease, the outbreaks in Africa, and a lot of folks from the CDC who have worked in the front line for a lot of these infectious disease outbreaks. So for me, that was the eye opener. And the best part was I was the only one from India. There were people from Australia and US who have applied for 6, 7 years and hadn't gotten into. So it was interesting to hear their perspectives. I think thanks to our training in CMC, that I was very good at picking up infectious diseases compared to a lot of these infectious disease doctors, right? So they actually got inspiration, and 3, 4 of them actually went to Vellore after that for their observership and to understand a little bit more in depth about infectious diseases. And it was a mutually beneficial thing, I would say. I learned a lot. Um, in terms of the scope or the breadth of what I could do. Briefly, these are the main two places that have changed my life. Then 6 years later, that's 2021, I moved to US to pursue my MS in epidemiology in University of Washington in Seattle, which was a 2-year program. And the best part was I got to work with the Gates Foundation. I got a fully funded master's, and I work with 8 different program strategy teams at the foundation.
Thank you for sharing your adventures. Justy, you have diverse areas of expertise, first as a medical doctor, then as a researcher, and now you are a technology leader. Your accomplishments do not follow a conventional linear career path, if I may say so. How did you make the switch from one phase of your career to the next? Will you tell us the stories about how you decided to become a medical student, then an internist, all the way to your current role as the product director in an artificial intelligence company? Your stories will serve as inspiration to our listeners and viewers who are trying to step outside the box but are hesitant to make the leap.
hmm Thanks, David. And I don't think a lot of people know about this story, so I'm happy to share. So I have not decided any of these pathways. I always had something else in mind, but somehow life happens and things change. So I just went along with it. That is my main key takeaway for everybody, is be open to change, because you don't know what is in store for you. I lost my mom to like sudden cardiac death when I was 12 years old. I'm the youngest of 4 children in my family, and 2 of my sisters are dentists and one is an engineer. So obviously, when we grew up, it was engineering, medicine. I mean, pretty much the standards. And I was very good at math as well. I used to solve for my sister's engineering questions. So I was always torn between the two. But I think with my mom's thing, I was inclined a little bit towards medicine, completely knowing that it's much more difficult to crack. So I focused then on the medicine pathway. And thankfully, I got into multiple opportunities. Got into St. John's, I got into CMC, AFMC, yes, even in Kerala, because I had a very good rank. So I started my journey in CMC, and that is like best decision I've ever made. The time in CMC that we had in hostels and with the classmates was phenomenal. Those 10 years. So that friendship we developed, and the teachers. So I was grateful that it worked out well. What I used to do in MBBS was that me and a couple of my friends, we used to go to these cancer wards, right? It was at that time L ward, and follow up with a lot of these children. About 6 or 7 children we got really close to. It started off with one of my relatives' friend coming, and that child didn't do well. Then I started speaking to a family nearby. So for me, I think hemato-oncology, I was very clear at that point. So based on that, I thought, okay, I should do MD internal medicine. And I did think about pediatrics, but I think medicine was where I was leaning towards. MD internal medicine, while I was doing that, in my second year, third year, I was thinking, do I do my super specialty? And then we started doing the super specialty postings, is when I felt like it was getting more and more tunnel vision into a specific organ. And I just wanted to be generalist, like patients being examined head to toe and not just a specific organ. So I then dropped that plan of even applying for a fellowship, like the hemato-oncology. So, anyways, things worked out. I also got married after my MD and moved to Bangalore Baptist Hospital. Dr. A.M. Chirian was there, and one of the ICU consultants left. Dr. A.M. Chirian said, "You're the person, you've done ICU posting in CMC, you take care of the ICU." I was very, very nervous about it, but thankfully it went well, and I managed that for about 6 to 8 months. That was in my second year at Bangalore Baptist. It was great. I enjoyed actually working, but all this while, like, it was always hurtful to see that we are losing patients, youngsters, to infectious diseases, TB and things like that, because they either discontinue medication or they're not taking care of their health. So they come in very, very late into the process. So all this while I was thinking about what do I do in early diagnosis. I even thought about to repeat community medicine or to get into a little more grassroots level to figure out preventive and social medicine. So then life happened. I got pregnant and I had a threatened abortion. So I had to take a complete bed rest. Okay. It was not something that I had planned. I just took off and took complete bed rest and thankfully had a child. So all that went well without any issues. But what happened was she started getting infections, urinary tract infection, that too resistant ones. So she was on IV antibiotics. When I decided to join back when she was 1 year of age, she again developed an infection. So I didn't have much family support, and my husband had a traveling job. So I decided to take care of her. So totally from the threatened abortion till she was about 2 years, I took a complete career break. I developed the other set of passions. So my cooking and baking, I didn't have any formal training, but that's when I established myself as an excellent cook and my cakes became extremely famous. Like I used to bake 15 kilograms of Christmas cake to be distributed. I pursued a little bit of guitar and things like that at that point. And then I rejoined back, and it was very, very difficult for me, like 2.5 years break. So I asked for a unpaid observership for about 6 weeks to 2 months. And thankfully, everything came back to me, like medications, dosing, and everything came back to me. I was back on track and I continued. And that's when I pursued my tropical medicine training. And then after my Peruvian adventure, I decided to step into epidemiology. I stepped into St. John's and I didn't want to enter the hospital space. So I joined the research institute. I learned a lot. Actually, I worked in the epidemiology and population health sciences division under Dr. Prem Moni. It was a great experience. I got to be a part of a lot of research projects, tobacco cessation services. I established a clinic, like an outpatient clinic and inpatient services. For me, I think it mattered if I'm able to prevent a few deaths. I know tobacco cessation is a hard bet. Yeah. So I did that. But things changed. Again, I was pregnant with my second child. And that's when 2016 is where Cure.ai, who was actually founded by my and my husband's common friend and his younger brother, when he started Prashant Warrior, his name is, when he started Cure.ai, he was looking at what field, medical field to work in. He kept telling me AI is going to be a thing. I wasn't very convinced. I said, okay. But he was asking what are the areas where we could work on, whether it's radiology or pathology. I got to be involved from the inception of this group that I work at the moment. And to be honest, when it started, when he said that we are going to have a software to detect abnormalities on chest X-ray, that I could buy, but to detect tuberculosis on chest X-rays, I had I had my doubts, and I should tell Dominic, my husband, that I'll help him out because he's a friend. But I don't know how this is going to work. So when he started, the first thing he developed was a chest X-ray AI software, automated interpretation. We call it QXR at the moment. So QXR was initially trained on 1,000 chest X-rays. And he showed me with 1,000 X-rays, we were almost 70-80% there in terms of sensitivity, specificity against the sputum test. So then I was like, okay, now you're talking. But because I was having a child, and again, I was worried how I would manage 6 months down the line. And then I got an offer to work part-time remotely from home. So I took that up.
Justy, when we were talking about getting you on the show, I had read some of the articles you had sent over and was fascinated by how deep artificial intelligence has embedded itself into the field of medicine. But before we talk any further, let me tell you a story from Greek mythology. Zeus, the king of gods, was holding a wedding banquet. Everyone was invited except Eris, the goddess of discord. Angered by the snub, Eris arrived for the party with a golden apple and threw it into the crowd. On the apple, it was written, "To the fairest one." Three goddesses immediately laid claim to the golden apple and asked Zeus to settle their dispute. However, Zeus, being a sensible god, delegated this task to the shepherd prince named Paris of Troy. To tempt Paris, each goddess offered him a bribe. Athena, the goddess of wisdom and war, offered him martial prowess and great victories. Then came Hera. She was Zeus' wife and the queen of gods. Hera offered to make Paris king of Asia and Europe if he gave her the golden apple. And last came Aphrodite, the goddess of love. She offered Paris the affection of the most beautiful woman in the world, who was Helen of Sparta. After considering the offers by the three goddesses, Paris finally awarded the golden apple to Aphrodite. And in turn, Aphrodite kept her promise by uniting Paris and Helen. And that brings us back to artificial intelligence. Like Aphrodite, what promise does artificial intelligence make to humankind? Please walk us through some of the important applications of AI in medicine and their impact on humanity.
I really liked your storytelling capability and how you're connecting the dots. So, in terms of AI applications in medicine, I think one of the most advanced field is radiology and imaging. We are one of the top players currently deployed in more than 105 countries. So, to me, some of the AI applications in medicine that stands out is ophthalmoscopy, dermatology, and pathology. So these are some of the main fields that have advanced in terms of AI, but also chatbots, LLM-based chatbots. So the vaccine safety surveillance chatbot that we developed in 2020, it was not AI-based, but now with LLM large language models that are in place, it makes the capabilities so much broader and the scope is so much wider in terms of what we can apply. And that's something that we're actually working at Cure. So Cure.ai gave me that opportunity to interact with a lot of business folks, engineering folks, and research and development. So I started getting interested in what this AI is. All this while part-time. And I got that flexibility to be with my family also. So in 2017 is when I officially joined them as part-time clinical advisor. Like I started enjoying working with non-medical people. There was these bunch of early 20-year-old IITians who I was teaching what chest x-rays look like, what are the abnormalities. I marked out abnormalities so that they could start training AI models on. And then in 2018 onwards, we started deploying it at sites in Philippines, in Malawi. I remember Malawi had zero internet. And I'm like, what are we going to do? Like if there is no internet, right? But they are no, they'll manage and they would solve for it. And that's the beauty of working with a different skill set people, because what I thought was challenge, they would take as an opportunity. So to date, I'm not worried about the technical feasibility. Something they will figure it out. I'm not worried about our group not figuring that out. Now, currently, Cure.ai software is not only in chest X-ray, we do CT brain for acute stroke, In fact, one of the main papers that I'm proud of, it was part of my MS epidemiology thesis, was impact of CT brain automated interpretation in Tezpur Baptist Christian Hospital. It is a pilot in a few hundred patients of stroke before and after AI implementation, where the AI would also alert the clinician on their phone if the patient has a critical abnormality. What is happening at the moment is, with the X-ray AI software, community health workers run the show in a lot of these developing countries, where they can take a call on who needs to undergo sputum tests. And as a clinician, what I didn't know was that asymptomatic TB is so high in the community. Up to 60% of the TB patients are actually having no symptoms, or they are unaware, or they're scared to report symptoms. So there are multiple scenarios, but it's that's where the chest X-ray AI is playing a role. There is no radiologist in some of the countries. For example, we work in Lesotho. Lesotho has, I think, one or two radiologists in that entire country. We are able to help or empower community health worker to triage who needs diagnostic tests. That impact is what drives me to look at TB. Similarly, we also do CT chest for lung cancer work, silicosis, heart failure, COPD risk scoring. We did COVID risk scoring as well. Currently, we only did radiology, but we know to empower community health worker, can we make them as good as a nurse or a clinician with the support of LLMs, the chatbot? If they see a sick child, can they ask the right questions so that they can figure out if the child needs antibiotic for pneumonia or evaluation for tuberculosis? So this is something that we've developed a prototype chatbot for it. What we are good at is radiology, imaging AI, and I can briefly tell about the impact that we've done. Our AI can work on digital X-rays, and it can also work on an analog film. If it's a rural clinic which only has the older chest X-rays that are analog, so you put it on a light box and take a picture with your phone, our AI can work on it. It doesn't matter what X-ray type or X-ray machine is being used. That is irrelevant. I think there is a misconception in general when it comes to AI in X-rays that it will only work with digital X-ray machine. That's not true. And there is also a misconception or a myth that AI only works if there is internet. No. So we can solve for it with a laptop, with a dongle, and it will provide the local cloud for the AI to work. It doesn't matter which part of the world we are in. We also leverage the newer technology like Starlink. Starlink is a game changer because it brings internet to extremely remote areas of the world. So even in Northeast Nigeria, we had an abstract last year presented at this union conference for TB and lung diseases. It was in Bali in Indonesia. And they presented how with Starlink, a laptop, and ultra portable X-ray machines in nomadic populations. So they're able to bring that AI into very, very remote areas there. Similarly, in Lesotho, they saw how our AI is being used. The X-ray machine is carried on horses to very, very remote areas with the laptop, and how it's reaching door to door for TB screening. Like we are also there in Everest Base Camp. We donated an X-ray machine with an AI so that anybody can get a chest X-ray for altitude related sickness. So it's clear that for us now setting doesn't matter. We work with this group, an NGO called Health Through Walls. They do not only TB, they do healthcare. They also do infrastructure development for prisons in low and middle income countries. And that work is incredibly powerful for me because there, the burden of TB is, we're talking about 30 to 50 times. There is overcrowding. Some of the prisons that they work in El Salvador is 700% occupied. And it's heartbreaking to see the photos from there where they actually stack up prisoners and they're sitting and sleeping on each other. So you can imagine that the burden of tuberculosis and other infectious diseases, they have other things also, measles, skin infections, all sorts of things. So what we started working on in Haiti, in Mozambique, and in Central African Republic. Funded, it was a funded grant. We were fortunate to be a partner in that. And this ultra portable X-ray machine can be transported from one prison to another. So once a year, they try to do prisoner screening with chest X-ray and AI, in addition to other tests. A skin test is what they do in Mozambique. But in Haiti, there's so much conflict. It was heartbreaking to hear some of these stories. When the prisoners broke out of the prison, they actually went into the streets and saw the situation was so bad in the streets. They came back to the prison. I mean, it was unbelievable. It is scary. Like, it is, I'm so grateful that we are able to bring technology to those people. Maybe they wouldn't have had any opportunity to go to a hospital or see a doctor, get a diagnosis of TB or lung cancer. I think this company feels strongly that think outside the box. It gives me that opportunity to think. So that's my story in short. I didn't plan any of this. It just happened to work out great, and the impact keeps driving me to work in this space.
Justy, thank you for sharing those incredible, incredible stories. This is so enjoyable to hear. I'm sure our viewers and listeners would relate to some of these stories. And now, let us continue with the story about Prince Paris. He returned to his city of Troy either by abducting Helen of Sparta or she followed him willingly. Thereafter, she was called Helen of Troy. However, Helen's husband, the king of Sparta, would not submit to this disgrace. Along with his allies, King Menelaus declared war against Troy. That was the legendary Trojan War we have all heard about. Many heroes were spawned during this war, like Achilles, Agamemnon, and Odysseus, amongst others. After 10 long years, Troy was destroyed and Helen reunited with her husband. And that brings me to the next question, Justy. In the long run, do you foresee that the drawbacks and complications of artificial intelligence would overshadow its promise, even to the extent of being catastrophic to humanity? Just like the promise made by Aphrodite proved for the city of Troy. Even though this calls for speculation, I'm sure our listeners and viewers would appreciate your considered opinion as an AI professional about the risks of adopting artificial intelligence into our lives.
Hmm. Thanks, David. And I think, yeah, there is good and bad. There is a spectrum. So I'm always worried about the negative aspects also. In terms of AI in radiology and the work we do, I think it's important. It needs to be done. But I'm worried about the other end of the spectrum, like ChatGPT, right? Would I want my 13-year-old to do all her homework through ChatGPT? No. Okay, so that is the other extreme. I'm really really worried. People realize there is shortcuts, and that's something that I don't know how do we regulate that part. And that is one worry. And I'm also seeing that it's that people are relying on it for medical opinion, right? Medical diagnosis. So those are things are the worrying end of the spectrum. And do I have an answer for what we could do? I don't know. At the moment, I can't think of any solution to prevent it. But yeah, I'm also concerned as much as a lot of other people are. I want to ensure people know that there are good things to AI. There are good applications. People have asked me multiple times, do radiologists oppose? But for me, at least for Cure, I can say most of our work is done in settings where there are no radiologists. So it's not like we are taking anybody's job. We are actually empowering whoever is there to help out in the community. So that is one of the things I just wanted to point out as a good thing.
Justy, many thanks for coming on the Oath and Staff podcast. You are living proof that human ambition is not linear. It is guided by our internal compass. And meaningful work, work that endures, lives at the intersection of multiple disciplines, identities, and callings.
Thank you, David, for this. I enjoyed speaking about a lot of my stories, and I really appreciate this opportunity.
And that's all for today, folks. I hope you enjoyed this episode with Dr. Justy Chiramal. Thanks for tuning in and subscribe for more.